Hi, I'm Jessie Golbus. I'm a heart failure and transplant cardiologist at the University of Michigan, and I'm part of the SFRN at the University of Michigan on health technologies and innovation. And as part of that platform, we're really interested in how we can use mobile health technologies to help patients with managing their cardiovascular health. So to promote disease modification and engage in behaviors that we know will improve cardiovascular health long term. So we've really thought about developing a remote platform by which to engage patients and using mobile health technology. So specifically what I mean by that is we have done completely remote consent and enrollment into our mobile health studies. And that's really helped us to engage diverse patients and improve scalability in our interventions. And so we've now implemented that as part of two studies with a number along the pipeline, but one looking at cardiac rehabilitation and the second in hypertension. So what we do actually is we engage patients through phone, or email. We schedule them for remote consent appointments. They undergo this interactive consent process within a mobile application. We mail them a smartwatch, and then we do a remote enrollment appointment either by phone or using video conferencing. And that's the way that we've been able to get patients into these mobile health studies. So we've, for our study in cardiac rehab, we were able to recruit patients both at the University of Michigan, but also from Spectrum Health. And then for the second study that I mentioned in hypertension, we've enrolled both from the University of Michigan, but also from Flint, Michigan, and specifically from the Hamilton Community Health Network, which is a federally qualified health center. And so thinking about different ways that we can use technology to engage patients in our clinical trials and then deliver our interventions is what our SFRN Health Tech Center is really focused on. Yeah, that's a great question. Certainly we've provided patients with smartwatches for participation, and we've tried to give them phone-compatible smartwatches. So we're device agnostic. So instead of kind of giving them, for example, only enrolling patients with iPhones, we take people that have both Apple Watches and Androids and provide them with a compatible smartwatch. So either a Fitbit Versa 2 is what we've been giving to Android users, or an Apple Watch to iPhone users. And so that's been really important for us for both giving them the smartwatch and then making sure that we use something that's compatible with what they own has been really important for reaching these populations. I think the future direction is generating the evidence to support these mobile interventions so that insurance companies hopefully are paying for these apps and these smartwatches for their patients in the future. But right now that's something that we're able to provide and do provide through our research studies.